so glad you are back for another episode of MB2 Underground. I am Sarah Kiefer.
And I'm Joe Fox. What's happening, Miss Kiefer?
I got a lot of caffeine.
Yeah, and you're very purpley today. I like it.
Thank you. I matched my blazer to my nails.
Yeah, we could have coordinated. You could have let me know and give me a heads up this morning.
How rude of me.
I do purple.
I just needed my own moment.
Yeah, I get it. Well, it's impressive.
Thank
Looking
you.
great, as always. So we've got another special guest. This one's going to be a fun one.
Do you think we'll ever have a not special guest?
Probably not. That's
Okay.
just kind of the energy I roll with, right?
Love it.
And every group here at MB2, and you know, the purpose of this podcast is not to be a advertisement for MB2, but every group we have here at MB2 is incredible. Best in the business by far, right? Mm-hmm. And this group is an example of that. And it's when I get to interface with potential partners in my role in business development, it's one of the groups I talk about a lot, right? Because it's a game changer, moves the needle for a practice in a big way. So
It's what everybody wants and what everybody's missing
and deserves
in private practice.
Yeah, 100%. So without further ado, would love to introduce the head of our payer strategy team here at MB2, Miss Candace VanCamp. Welcome, friend.
Welcome.
Welcome.
I'm so thankful to be invited.
We're glad to have you. Can we, when we intro her, do the clapping background, like, you know what I'm talking about? I just felt like that would have fit there.
So anytime we, you know, a lot of groups here at MB2 send emails when there are updates, and I love getting your group's emails updates. I think they're really awesome.
You know, everybody's looking forward to those.
They're
They're so much fun to push out.
Yeah.
It's like you can work for 6 months pounding on something, and then there it is.
It's like you can feel the effort through
Yeah,
those
the energy's
pushes.
building. It's this big crescendo, and then we've got an effective date, and
Mic
we're
drop.
ready to drop it and go live. So
So
super exciting.
Before we get into some of that awesome, exciting stuff, why don't you take a step back, right? Tell us about you a little bit, kind of how you got into dental, how you met MB2, but maybe first and foremost, I heard you got a few grandbabies.
I do.
Your grandma?
3.
Tell us about them.
I have a 5-year-old grandson and then 2 twin girls,
my
identicals, a year and a half old.
Wow.
Yeah.
Fun ages. Are you expecting to have like 12? Did I read that?
Oh,
correctly?
absolutely.
How did
well,
you?
yeah.
Did,
So
did
we
you
have
give your
4
kids a quota?
Yeah. Well, actually, yeah, we did. So my husband's really into football, and he says
Yep.
it doesn't matter how we come up with it,
But we need 12.
we need a
Football
football
team.
team. So,
Love it.
you know, some of you can pick up the slack a little bit more, and
Yep.
you know,
Exactly.
so
Decide
anyways,
amongst yourselves how you're going to
right,
divide and conquer.
That's it.
I actually, Ms. Kiever talks about vision boards and manifesting your reality in your future and, you know, thinking about your goals. And I put myself in that grandfather role so often. I just can't wait to be there. So I know it's such a special time.
It is the best. You know, you still have a little bit of that hardship, right? When you're telling them no and you don't want to, but you know you're going to get in trouble with your kid if you don't hold the line, right? But you get all the good stuff, and then you get them back to their parents, and they go home, and
You get to go to sleep.
and you can't wait to see them again. So it's almost like Disneyland grandma, you
love
know?
it.
Oh, I love
So,
that.
The
Good
good
for
stuff.
you. Awesome.
We should trademark that.
So Candace, how did you get into dental?
Oh my gosh! So I'm in my early 20s.
Yeah.
I'm actually in medical. I'm going to go for nursing, and then my life changed a little bit. My best friend was a dental assistant, had gone ortho. She's like, "You should come over on the dental side," and so I went to work for a DSO centric to Pacific Northwest. It was primarily all managed care,
Interesting.
capitation. And it kind of blew my mind, but I loved it at the same time.
Yeah.
And I was lucky enough to work with a dentist that would explain to me what it meant. Like a root canal, I didn't know what it was. I just knew it was bad and you don't want one.
Right.
But and I'd say, tell me about this. And he would draw me a diagram of the tooth. Well, you see here the pulp chamber and all of this. And it's like, okay, that is cool.
Yeah.
I really like this. And so I worked with him for several years.
Yeah.
Went on to manage his practice and then specialty practices, GP practices in the
Wow.
Northwest. And and then I went to work for another large DSO. That's when I learned about fee for service.
Oh, yeah.
I didn't even know what that was.
The sweet spot.
Right? Yeah. Since then, it's been a lot more fee for service than DHMO, and there's no problem with that.
Yeah, absolutely.
Yeah, I want a wide swing from, managed care to fee for service.
Yeah, it's a very unique niche. Works well in some areas. I opened a practice up in Washington, and my primary business was DHMO. and I was doing over 300,000 in the first 24 months at that practice. It was crazy.
Yeah.
So it can be, sometimes, it can work depending on your community, where
Fits
you're
the
at, what they've
needs.
got going on.
Yeah.
Or it's a, don't even look at it. So,
Wow.
yeah, found out more about, all of those different niches, though. And the more I learned, the more I loved it.
Wow.
So, yeah.
Awesome. How'd you meet MB2?
I was recruited.
That's what I love about MB2. If you've got talent, we'll find you.
Yep.
Well,
Absolutely.
and I wasn't looking, and I wasn't, I'd worked for the same company for 17 years.
Wow.
I would consider them all very dear friends. They were very, very good to me.
Oh, that's amazing.
And it was a great experience for me. But what I was offered is come over and build something.
Yep.
And that's something that I hadn't got to do from the ground up before. And that was almost 3 years ago.
Wow.
In August, it's going to be 3 years. It's been a whirlwind. It's been exciting. I love how it touches individual dentists.
Oh my
Because
gosh,
that, when you're with a DSO, it's a lot different. It's mainly a structure where it's more from the top down. And I oftentimes, talking to people about MB2, this is an inverted pyramid. With us, 727 practices right now. I have 727 bosses at minimum that I'm trying to service and make sure that they're happy.
And it's crazy to think about, like, when you started 3 years ago now, that was the genesis of this department. So another example of MB2 identifying a need and then trying to find and align the right talent to, like, build it. And 3 years ago, I remember even at the time, private practice doctors coming and asking what we were doing about fee schedule reimbursement negotiations. And I didn't really have a lot to tell them. And it's so cool to see the jump from then to now.
Well, it was Clint. Right, Clint, our
Clint
chief
was the
revenue
guy,
officer.
yeah.
He was the department at the time.
He'd
right?
be doing all these other things and put on the, I'm a payer strategy hat person and go after it. He actually was doing pretty darn good, there's only so much Clint, right, that can be spread.
So tell us, walk us back 3 years, how you built the team, what the team is now in terms of, number of people and capabilities and kind of what you're doing to help our partners.
Well, right now we're at, I believe, 13
Wow.
on the team. And so we've actually divided up. As this has evolved, we've realized that there's some of the people on my team, customer service, they love it. Everybody on my team loves customer service.
Yeah.
That's incredible.
That's a requirement. If you don't like to serve, it's not the spot for you.
Yeah.
Right.
And sometimes, we've got somebody that's, on a bad day and it's like, my claims aren't getting paid but they dive in and go, let me fix that for you. Let me see what I can do. So it's that kind of personalities that we go after.
Yeah.
But we have negotiation side. I call them outward facing. These are payer relations managers that are managing those relationships with the payers. Looking for opportunities where we can either have like state level or even local level schedules sometimes that can really benefit all of the practices in that regional area. But we do one-offs is what we do. So they're working on that side. But then internally, we also have the bulk of the team. I think we have right now 7 people that are working on what does that unique practice need? What does the owner want? What are they looking to change their payer mix? Do they want more volume? Do they want less volume?
Different
Are they
volume.
looking for different volume? Yeah. I mean, right before I came in here, we talked about a practice that, same owner for years, very healthy, vibrant practice, decided to grow, bring in a new associate. And now they want, it's like, now that there's 2 dentists, there's less volume. Well, maybe they want to turn on some partnerships. So then they come to our department and they say, hey, what would make the most sense? Where could we get the most bang for our buck? We want pricing that's, minimal, what the market level commands. We don't want some bottom of the barrel kinds of discount plans or anything like that.
Such a valuable resource.
Yeah, so we work on those kinds of projects. Pretty much whatever the owners are interested in. We do a lot of Zoom calls all day long. We're educating. We're hoping people understand, like, lease networks are a big thing right now. So pretty much whatever the need is, we're trying to find a way to fill that. And when we start hearing it more than once, well, now we need to create a program or policy and procedure. Here's when we see this, these are some of the resources we're going to get them. This is, we'll set up a call for sure to talk to them and make sure that we're not missing anything.
I love it.
And then our team goes out and finds out what we can bring back to make them happy.
And then it's built for the next one that needs it.
Yeah, well, it's always unique. So we have a template, but it's different for every single owner. Yeah.
Well, and that's Clinton Ellenberg, Chief Revenue Officer, likes to say we are purposefully inefficient, right, in that regard. But it's so special, right? Everybody gets, like you said, it's the inverse pyramid, and that's how the MB2 model works. So tell us go back to those lease networks. Maybe it's a newer development. Can you talk to us about that, what it is, and just educate some of our partners maybe not know, or some of our listeners may not know kind of what those are.
It's gotten so crazy out there. Even the payers can't wrap their head around it. Right. What they started doing was they wanted other payers' fee schedules and regional access points, and they wanted to use those to find ways to reduce what they were paying. But then the one that they selected, which looked like a good option, it was a reduced schedule. Turns out they're leasing their schedules, and so it could be a lease of a lease of a lease.
Wow.
And it's gotten crazy. So even the carriers now don't know. We call it Plinko, right? You drop the claim in at the top, and it starts bouncing off of different networks and different companies, and you don't know what's going to end up at the bottom.
Is that an acronym? Plinko?
It's a game, right?
Come on. In the 80s, probably.
I'll Google it. Okay, sorry. I was just making sure I didn't miss something.
Wow.
Yeah.
So it's Plinkoing.
Right. It's kind of like a ping pong ball bouncing off of different networks. And it's become a real challenge for offices because most offices want to talk to the patient about, here's what your insurance we can expect that they'd cover for you.
Yeah.
And therefore, we just only expect you to pay this out of pocket today, and we'll bill your insurance. Well, when the claim comes back and it's vastly different than what they had estimated, now, of course, that's put the practice in a bad light with their patient.
Absolutely.
Challenging, the provider trust relationship that they had with that patient. So it's gotten really challenging. It's something that our team goes after. We try to track that. We've even started, kind of, I'm going to call it a flow sheet or a spreadsheet, tracking where we're seeing the leases. So if it's hitting on a certain payer first and they're not in network with that unique payer, then who covers that payer? What are the networks that support or that are leased?
Wow.
It gets very interesting, but we're starting to track it more. The thing is that it's also moving at all times.
Right, like I picture one of those like detective murder investigation boards where you've got like the ropes and it's like, oh crap, it isn't this guy, so we've got to now move it over here because
it's exactly
it
that's a great analogy,
Wow.
way to look at it. Yeah.
So that insurance verification is, it eventually leads to collection problems, right? And
huge.
not being able to collect on quality production. That's a concern. That's a problem. So how else has insurance changed? That's one example in your experience and throughout your career.
Well, I think probably the biggest change that there's been right now is an assumption that anybody that's insured, and I'll put quotes on that term, through a unique network, that there is a premium payment that's made every single month. The payer, the insurance company collects that premium and they put it in their bucket. They put it in their account.
Okay.
And now if a claim doesn't come through for that person over the period of a year, right, then it restarts as of January 1.
Okay.
And they get to keep all the bucket of money. That's not what's going on anymore.
Really?
Yeah, that's old school.
Interesting.
The majority of plans now are self-funded.
Oh.
And so you've got a large employer, I'll just say like an Amazon.
Okay.
And everybody in Amazon is putting money into the Amazon pot. And now Amazon goes out and says, well, we don't do dental claims. We need somebody to do our dental claims and to administrate our benefits for all of our employees and their dependents. So they'll go to different large networks, usually a Blue Cross, a Cigna, an Aetna, and those entities are all competing against each other. They all want the Amazon business. Usually whoever has the lowest fees and has the most amount of access points in that general area, or if it's like an Amazon, it needs to be nationwide, right? They have to have a lot of choice, they're the ones that are going to win the contract to administrate Amazon's benefits then. So when they get the claim, they're simply taking Amazon's checkbook and they're writing a check. It's not insurance anymore. So there's no pot of money at the end of the year that they get to keep. So there's different payment structures that are occurring. It could be that, because Amazon has 300,000 employees, X amount of dollars is going to be paid to that entity to administrate it.
Right.
Or it could be per claim. Every single time a claim comes through an Amazon claim and that entity administrates it, then it's $5 per claim. Different payment structures, all depends on the groups, what's negotiated on the front end. But it's changed the game when it comes to that pot of money that the carriers have to work with.
Yeah.
So how are they navigating that impact to their profit? Because essentially it's squeezing them, right? Their profit is being reduced, and so how are they responding to that?
Well, that's where when we're banging on the door saying, well, we need price increases,
Right.
They don't want to do that. And that's the main reason why so many dentists now, they haven't had increases for years because the payer will do anything to avoid that conversation. That's an increased cost to them. They're also looking at reducing their costs. So how did they do that? Well, I think the majority of people are hearing that these insurance companies are doing major layoffs.
Yep.
I mean, Guardian just went through another complete riff here just about
That's
3 months
been a
ago.
big issue.
It's happening across the board with these insurance companies. So how do we compete as, for MB2, we're looking at how we might be able to help them with their problem. Any good negotiation, you got to understand what the challenges are on the other side to be able to come to the table with something that
solves their problem.
Yeah, and so we look at efficiencies that we might be able to apply from a high level. An example of that would be electronic claims. It's amazing how many practices are still out there writing, claims.
Paper.
Really, they're paper claims, or they generate them out of their system and then they, put a stamp on them and send them off. Yeah, that's very inefficient for a carrier because now somebody's got to be in the mailroom, open up that piece of mail. They got to flatten it out. They've got to scan it into the system, right? All of these steps take time and it costs the carrier money. So things like helping a practice to become really efficient, with electronic tools.
Only allows us to negotiate better.
Exactly.
Brilliant.
Yeah,
We'd like to, save them some money, but, we'd like some of that back to our
please.
dentists also.
For sure.
How many, on a percentage basis, of the fee schedules that you evaluate, and that process occurs naturally with a new partnership at MB2, right? How many of those fee schedules would you say are below market?
Oh my gosh, the majority of them?
Yeah, that.
Not surprising.
That blows me away.
Yeah.
And that's like a message I always communicate. It's like, hey, doc, you probably haven't had a chance to really look at your fee schedule and definitely haven't had time to negotiate it because, A, you don't have the information to know what market is.
I was just going to say, how do you know as an individual dentist if you're at market value?
Exactly.
Right?
You don't.
I mean, I see practices that I look at and they're 60% over market value and they're like, I need an increase. I've seen that in a few cases.
Wow.
And then I have to go back and, sometimes deliver the message that is, you're actually on a great fee schedule.
Yeah.
Don't change
Enjoy
it.
it.
Don't put in any
mess it up.
changes. Don't send in anything to the carrier. Just hold. That doesn't mean that next year it's not going to change and something would be different. If their lines of business change, for instance.
Yeah.
We're also always looking for unique opportunities for our owners here at MB2.
Yeah.
If I find out that there's a piece of niche business that might affect, well, then I want to go to that carrier and find out how can I make sure that our practices are, getting the benefit of that. So
No, for sure. And I know Joe just spoke about when a new partner joins MB2, what resources are deployed from your department to support our owners. So the way I normally talk about it, absolutely correct me if I'm wrong, is 3-pronged UCR analysis, payer analysis, and then reimbursement negotiations.
that's right.
So if I'm not missing anything, what have you seen make the biggest impact on our practices? I know all of it is obviously a huge miss in private practice, but where do you see the most impact?
Well, the first thing you mentioned, so the pricing. We, as an organization, made a decision to support all of our partners by buying the same data that the insurance companies use.
Wow.
And that data is incredibly expensive, but incredibly valuable to our partners as well.
Yeah, we got the inside scoop.
Yeah, so we're looking at that data And we're determining at that point, are they at fair market value with their usual and customary pricing, their standard fees at the practice, but also what about with the carriers? Are the carriers really paying their fair share based on the market and the level of service that this unique practice? I mean, I pull all their data. I want to see that practice's unique data. And when I see that they're sending a large volume of, patients to that practice and they're managing their needs, they're, holding up their end of the bargain, then I'm going to go back in the conversation about negotiations, say, look, this practice has seen, 500 new patients for you in the last year. This is a practice that really is taking care of the members. Obviously the carriers are looking for specific things also. When they see super high utilization on some unique services, dentists can get flagged. Too many crowns is an example, right? More crowns than anybody else in that geographical area. Right. That kind of stands out to carriers. But when they see that a practice is pushing, high volumes of preventative services and that, it's very meaningful to carriers.
And how does MB2 compare, generally speaking, in that regard, and the utilization?
Well, from what I've seen in the data, we're actually higher. And so that's, something that I'm always having in the conversation. I'll bring the data to the conversation. I don't just kind of, poke around at it. And that's, I guess, where independent practices, they don't usually have the ability to, go and position themselves. They don't have that data. They don't know what the data is within the region. But I'll always utilize that. Yeah. It's like, 72% of all preventative services here at MB2. So the focus is on community health, oral health, and, high level of that is preventative for sure.
Yeah, and you can definitely compare the independent practice in that regard versus group practice, generally speaking, and groups in the opposite end of that spectrum. And so insurance companies should love the MB2 model, right? How much does that data cost you? Is it like $75,000? Is that correct?
Keep going.
Wow. I feel like she just gave you the.
Well, I quote that number.
She just gave you that's cute. Look.
That was that's one set of data, but we actually buy into 4 different data sets.
Unreal. And that market rate, I'm so sorry, is that a per zip code market when you say what market for fee schedules?
We're looking. Well, it's not really zip code. They call it GeoZip. So you're looking at the first 3 digits of a zip code. Okay. So for us here in Carrollton, 750. Yeah. And if you look on a zip code map, you'll see that this greater Dallas area 750, but 751, 752. Then you got Fort Worth. It's 10 miles. Yep. So there's actually probably about 8 just right here in this general geographical area that we look at. So it is very specific.
It's crazy. No wonder private practice can't keep up. The financial responsibility of doing something like that, the data analysis, like having the time to do all of that, it's impossible for private practitioners to keep up.
Well, and then the negotiation process,
that's just getting ready to have the conversation.
Yeah, and who, not only just the time of that, but who's really amped up to fight, and have a negotiation, and you don't have the data.
It is a fight too. I have to be honest, some of the biggest national carriers, and I won't drop names, but their standard is no. Yeah. And then you appeal it, and their second answer is no. And then some people believe, well, I'll just say I'm going to terminate. No. So send me the termination, and we'll get right up to the date, and then maybe I may come back and give you an offer, or I may just let you terminate. It all depends on how many access points I have in the area. So that's what the carriers are thinking.
I am taking you the next time I buy a car.
Seriously.
Man.
But that's an incredible skill set, and not always a time suck for the average clinician, the average business owner. But it's a whole nother level of skill set that most people just don't have, or they're not kind of born with it.
I wasn't.
Confrontation is hard, and tough conversations are difficult for most people. So your team,
and it doesn't have to be tough. I know of plenty of large groups,
really take the bully tactic,
and it doesn't work. Yeah. We have meetings with these carrier partners all the time, and as a matter of fact, they don't want to answer or talk to those other groups because of that tactic. Wow. Who wants to do business with bullies? And
someone they're annoyed by or scared of, or aren't pleasant to interact with.
Yeah.
So when your team goes and negotiate on behalf of an MB2 partner, how is that process different than just the solo practitioner going to negotiate? Do we have a special
we have special reps. Yeah. Absolutely. Yeah. So we're assigned reps. that when we have a need, we're able to reach out to them. We also try again to understand their side. So many times we're presenting an agenda. So these 10 things, I want to ask about these, fee adjustments. I want to ask about the negotiations for these 3 areas. It can vary that way, but I'm presenting that to them via email first, gives them an opportunity to look at what my requests are, dig into it a little bit. So now when we get on the phone or a call together, they're already prepped. They already know what it is I'm looking for. And again, I'm being, reasonable. I come with the data first. I would never just, I call it the feel-good method, right? I'm thinking, $1,000 sounds good. Carriers don't operate off of that. They're all data-based, and they have actuaries that sit there and crunch numbers all day long.
When you have all the experience to understand the impact, so like you mentioned earlier, you're able to see both sides, and you're not just coming at it from the us, we. You get to have the advantage of being an advocate for all of our doctor partners, but also understanding the impact from both sides. Everybody wants to feel like they're heard.
Yeah, absolutely.
Well, one of my commitments to the carriers, though, is that I'll do recruiting for you. I'll likely find you some additional access points, some dentists that you've been seeing claims come through, and likely that doctor would be willing to participate if it makes financial sense for his practice.
Right.
So that's the key there. So I will look at the
Mutually
numbers.
beneficial.
Yeah, and then many times, we just did a large negotiation in a geographical area. 6 MB2 dentists said, yeah, we'll do it.
Wow.
They were out of network before. They want to go in network. They know the carrier will send them volume, right?
Okay.
Yeah.
And the fees made sense to them.
That's
and
super
so,
cool. That's a
Yeah,
win-win.
so that's what, you wouldn't believe how much carriers pay for recruitment departments. They're out there knocking on doors trying to get attention to try to get an access point. But we'll do that internally. Doesn't mean that the owner, there's times when I look at it and this makes really good financial sense for the practice.
Wow.
But the owner says, no, we're not really interested in that.
Yep.
All right, that's fine.
Well, and what a cool flip-in perspective. I feel like so many practices in network or that have dropped all the payers they're contracted with feel like it is a fight and a battle and an us versus them. And you found a way to turn it into, like you said, like a mutually beneficial relationship. You show up well and, work with us. We're going to send you people that trust you because you've built that trust versus it feeling like you're just butting heads all the time.
Yeah, that's not a way to operate. It's not beneficial to either side. And, hurt feelings last, right? And we don't want that either. So not only that, but from my perspective, we're representing the owners here at MB2.
Yeah, absolutely.
I would want to make sure I'm representing them well.
Right.
So how does the solo practitioner practice that's unaffiliated with a group? How does that process work for them? They just call an 800 number, or their OM calls an 800 number, and then maybe somebody answers?
Yeah, send an email, write something on a piece of paper and send it via the mail. There's all these different ways, and you're trying to get their attention. You're standing in line for a long period of time. You can put your request in. You're always writing down your reference number of the call and the name of the person and the date you talked to them. Because otherwise, those tend to
Back
get
of the
lost.
line.
Yep.
Right. But yeah, it's a long, lengthy process to try to capture their attention. And again, the first thing the carrier is going to look at is what's the volume that we are sending through that unique practice? How beneficial is that practice? How many other access points do I have in that geographical area?
Yeah.
Carriers tend to look at like a 10-mile range and say, if I already have 15 other dentists that are right there in the area.
I don't really need you.
Right. Well, why do I need to pay you more?
Yeah.
Right?
Yeah.
That's how they look at it.
You and your team are already doing a whole lot. What are you guys working on now, or what do you see coming up next?
Well, we're always working on, the usual and customary reviews for all of our owners. That's an annual process for us.
Is it really? Every year?
Every single practice. We're always looking at that. For new practices that are partnering with MB2, we try to do those within the first 60 days. We want to make sure that, they do have that information, that they, get off the partnership with us on a good footing. But then, it changes, throughout the year. The data that we buy is usually 2 drops per year, kind of like a winter and fall. So we want to make sure that if there's any changes pricing going on, that we let the owners be aware of that. We present what looks like it's the right pricing based on all the data, and the owners make the decision. Sometimes they're yes, Sometimes we only do it January 1st, so hold on that and we'll do it, 6 months from now. It's all, each individual practice managing it differently. The other thing that we're doing, though, is those payer reviews, as we call them. That's where we're essentially kind of like financial analysts. You're looking at their portfolio. You're looking at what carriers are they participating with. Are they bringing the expectation, right? Usually it's volume. Most of the time when a practice owner decides to partner with a carrier, they're giving a discount in exchange for pushing more patients through the door.
Right.
And so we evaluate that. We want to look at that partnership and see, is it still making sense?
Wow.
Is it beneficial? Should we reduce it in some way? Should we hold? I mean, we have practices that will say, we have more than we can handle. We had 3 dentists and we lost one.
Wow.
He retired. So now we're just super booked out. And we may go to the carrier on their behalf and say, hey, so we're going to hold on the new patients for a little bit. We're not going to cancel or terminate, but we'll reopen the new patients here in about 6 months. Let's let the practice do a little catch up. And then we'll come back and circle back around. So it all depends on the practice, but we're doing those pair reviews to give the owners a full understanding of how those partners, those insurance carriers, are performing for them.
Well, and the amount
incredible.
of doctors I've heard that prior to joining just kind of hoped for the best and like would make changes and evaluate and be like, oh, I shouldn't have done that, and trying again. You're providing the data up front and making the recommendations. They still get to choose what they want to do, but that it feels like a lot less trial and error in that case.
Well, and we have some that say cancel everything. And it's like, well, I don't know that I'd recommend that. Maybe how about these, we'll start with these 3. They're more lower, volume, and see how that works out. And then maybe we'll target these 3 next and those 3, step by step. Because it may be that you cancel the first 6 and now you're in the sweet spot. Okay, great.
Boom.
Keep on going. So, it's all individual to the practice.
And being able to quantify that for a practice is incredibly valuable because, I mean, that relationship is very emotionally charged for good reason based on, historical, experience, right? And so that concept of like, drop them all. Well, hey, maybe that's still your decision, but hey, maybe that doesn't quite make sense now. But wow. Where do your team members come from? Like, what are their backgrounds?
Oh my gosh. So, all of them pretty much, except for a couple, all from the office, ground up. They were dental assistants, some hygienists, lots of office managers.
Yep.
They've got to be able to understand what's going on at the office level to really be able to manage and navigate. I mean, we look at everything from, EOBs that are coming through that aren't getting paid. Well, okay, what happened there?
Wow.
Was it a contracting issue? Was it, something, what's stalled out? Is it a unique network? I mean, like one of the national carriers, like over 50 different networks nationwide. Well, it could have been a patient from that one unique network.
Jeez,
so they're in network with the other 49. It's things like that my team helps kind of sort out and get to the bottom of. But it's a lot of at the office working through issues like this. The majority of them all have contracting and credentialing experience.
Wow.
Others come straight from the carriers.
Ooh,
Others
so
have the revenue cycle background. And so we've seen full circle, what happens at the office, when I push something out from the office, where it goes and what happens with it, how it's processed. If it's denied, what I need to do to get it back through.
Payment consent.
Yeah, and that's crucial for being able to, figure out what the problem is for that office and navigate the solution.
So you know how the sausage is made. Your team.
That's it. The
that's
recipe.
pretty special. Yeah. Awesome.
Yeah.
It just as a finance geek on the business development team, the number way to increase the profit of a practice, right, is to boom, fee schedule just went up, right? Immediate revenue increase, no expense increase whatsoever.
Yeah.
Like that's
incremental
huge,
right there.
Huge. And then the impact of profit is exponential off of that.
Yeah.
It's so profound. Again, I love talking about your team when I'm on the road, meeting new partners, and I think it's what you've done those last 3 years is absolutely incredible and such a great benefit to our partners.
It's been fun to build. Like I said, the team loves what they do. They dig in. What they really enjoy is those video calls that they have with the owners, because it's really the only time that they really get to touch who they're actually serving. Yeah. So it's fun for them. They look forward to those kinds of conversations and visits.
I love it.
Awesome.
Yeah.
I think that this has been great. I think it's really good exposure. I think that it's such a big value add and it's such a selling point, as Joe says, but I think it's also now the opportunity for people to get to hear directly from the head of our payer strategy team and get to see your face on video and get to connect with you a little bit more. I know you guys have the Zoom calls, but I do still think it's an opportunity to get to know where things are at now, what you guys are working on, and what's to come.
Yeah, absolutely. We appreciate you taking the time, Candace, to come
Absolutely.
hang out.
Thank you so much.
It was exciting. Thank you so much for inviting me.
Awesome. Excellent. Well, listeners, I hope you enjoyed that episode of the MB2 Underground podcast.
And if you didn't, pretend like you did.
Impossible
Enjoy
not
it.
to enjoy it. But we will catch you next time. Thanks so much.